One of the reasons I've supported so many individuals and mentored so many individuals is because I'm a strong believer that organizations can't be successful unless everyone in the organization is on the same page and committed to the same goals. And a good leader has a vision about what they think their organization ought to be, what it ought to accomplish, what its challenges are, and in each case, the individual that's been involved has been someone that I really wanted to assist and make their life better and make them a greater contributor to the organization. For instance, when I retired, one of the things that I have always done is been very committed to assisting women and minorities in their careers. And when I retired, the morning after my retirement party, I was surprised by a breakfast of 41 women who had something to do with their careers, and that group named themselves Gail's Girls. So that kind of explains why I do it. One of the things that particularly impressed me was Dr. Wisdom when I first met her, which is a lot of years ago, but she's always been very committed, and I've known her back when she was an emergency room physician, and then saw her develop over time, and she became the great woman that she is now. When I urged her to go for it, when it became clear that having a state surgeon general was a good idea. And she was a little nervous because she, I think, wasn't sure what she was getting herself into, and she wasn't interested in getting involved in politics because that always is a possibility when you accept that kind of role. I think being the Surgeon General for 4 or 5 years have made her a better leader and more knowledgeable and one who is able to advocate for the right things as it relates to multicultural health. I was very proud of the fact that she was the nation's first state surgeon general. And that had a big impact upon health policy here in Michigan, and it had a lot of impact on other states who adopted the model. My wife and I were trying to decide where we wanted to make our investment. As I retired and we got older, we felt that this was a great need, that we probably would never have created the chair if Dr. Wisdom didn't exist and hadn't led the effort to develop these programs. And because she did, instead of funding research in cancer or another academic program, we felt that we could have the most impact Plus, we believe in it. We think it's the right thing to do. And it also is a good business. And for those reasons, we decided to make our investment in multicultural health. And in Detroit, there's ample opportunity because we have not only a large African American population, a large Latino population, and we have a large Arab population. And each one of those has their own perspective on healthcare and their own religion. So for all those reasons, that's why we did it.